I haven't had Botox in 3 months, and so right now it's like my eyelids are, I feel like they're retracting. Everything is very hard to move, even more so when I get Botox. This muscle is more stationary and I'm able to pull my eye down at least like that. But since I don't have Botox, it feels like my eyes are, it's just widening and widening, and I try to pull down and I can't. And then to straighten, I pull out, I pull up, I guess. I'm not really sure what I use. Do I use my lateral? Do I use my superior rectus? So this is me. I'm very, again, it feels like there's a lot of eyelid retraction. You can see the whites of my eyes above and below. I'm not sure why this happens. When I get the Botox, it calms this muscle right here, this muscle down, because it does feel like there's a muscle here that I'm using to constantly pull that eye open, to keep it open, because the minute I blink, it goes in. So I'm using a muscle right here. I don't know if it's a muscle right here. I think I'm using a muscle right here to keep that eye from blinking, from going in. So again, I'm very uncomfortable right now. I know it doesn't look like it. If you picture a Graves patient, Graves disease, what that does, that's exactly what it feels like. I've had doctors ask me that before. Again, it's been 3 months since I've had Botox right here. That's something I haven't mentioned to you, Dr. Stavis. I'm constantly pretty much doing this all day to keep that muscle out. I do have, I know it looks, I don't know if you can see it, but when I go down, my lip curls a little bit. I didn't mention any of this to you. I didn't know there's so many pieces, but again, I do get Botox right here. I started getting it right after the surgery more because my eyes get so wide-eyed because I can't, I guess I look down and then I got to pull the eye out and then it gets wider, and this is to help give me something to work off of instead of just pulling. I don't really know if that makes sense. None of this makes sense. But as you can see, I just don't have the ability to move my eye down anymore. It just pretty much been double vision the last few days, and trying to figure out, get a doctor to give me some Botox ASAP, because it just feels like all the tissues around my eyes are dry and ripping, and I just have to keep it in that double vision position. Otherwise, I'm pulling too hard to get it out, and that's making my eyelids retract even more. And again, it feels like I'm pulling the tissue here and here, and that's exactly what happened after my my medial rectus surgery in 2004. I had so much pressure here and burning sensation here because even though they moved the medial rectus in, I was still having to pull my eye out. Whatever I do, feels like I'm using this muscle right here. A muscle is at the superior oblique, or maybe I'm lifting. I don't know what I'm doing, but I still feel like it could be an oblique muscle that I'm using to keep that eye. Every time I blink, I'm pulling it out, and every time I look down, and I have to pull it out. But again, I'm so wide-eyed right now, and it's hurting. So I'm going to sign off. I just wanted to send this to you, Dr. Stavis. And again, I'm sorry for being a crazy patient. I'm just having problems. Thank you.